Is hair loss. I think that is a so very universal side effect of chemotherapy. It's not a permanent loss; it's a temporary loss. And females, women, they regrow their hair. And the best way to cope up is have them cut short and perhaps accept it or acquiesce to the hair loss. There are some scalp cooling machines which have come up which can prevent hair loss, not altogether zero, but yes, almost 70% lesser hair loss, and about 20% patient may still have significant hair loss. But this is one thing which has come up.
Today we have with us Dr. Manish Singhal. He's Senior Consultant Medical Oncology at Indraprastha Apollo Hospital. Thank you so much, Dr. Singhal, for joining us on this session.
My pleasure.
We have specifically a couple of questions around chemotherapy, and the idea of this session is to spread cancer awareness so that women can detect cancer early and know more about the cancer treatment. So one of my questions to you is, what are the physical changes that women goes through during their breast cancer chemotherapy treatment, and how to cope up with them?
So I think the foremost is hair loss. I think that is a so very universal side effect of chemotherapy. It's not a permanent loss; it's a temporary loss. And females, women, they regrow their hair. And the best way to cope up is have them cut short and perhaps accept it or acquiesce to the hair loss. There are some scalp cooling machines which have come up which can prevent hair loss, not altogether zero, but yes, almost 70% lesser hair loss, and about 20% patient may still have significant hair loss. But this is one thing which has come up, so this is definitely a welcome move. The other things are nail changes, color changes, and skin changes which can happen, and these are all again temporary. And the nails do tend to become very brittle and they fall off. I know that women are very fond of having good, nails and doing manicures and so on and so forth. But these are all temporary changes. Other more significant changes which are more important for a medical oncologist is that it can cause diarrhea, it can cause fever, it can cause oral ulcers, potentially. It's not that every female or every woman will have it. And there are preventive strategies for it. It can cause nausea and vomitings. And so there are a lot of preventive strategies which we explain to the patient, and there are preventive drugs which can take care of vomitings, diarrheas, and blood counts falling down. So there are injections which can be taken to prevent blood counts from falling down, such as hemoglobin not to allow hemoglobin to fall down, or the white blood cell counts, which puts off their immunity, or even the platelets. Now we have got a lot of supportive drugs. I think the take-home message is, as chemotherapies have evolved over a period of time, so as there's the supportive care which has evolved over a period of time. And therefore, these toxicities have become much more manageable. Not to say that there are no toxicities now. Certainly there are side effects, but many of these toxicities have become much more manageable. So that's, I think, the take-home.
And my second question is, does chemotherapy treatment affect your chances to conceive?
Certainly. The simple answer is yes, it does. And nowadays we are actually seeing a lot of younger women getting affected with breast cancers, and they have to go through chemotherapy. And chemotherapy definitely decreases their chance of conceiving in their future life. And not only chemotherapy, even hormone therapy. Many patients have hormone positive breast cancer, so they have to receive hormone therapy. That also decreases their chance of conceiving. However, there are certain things that can be done, such as oocyte preservation, that is, the ova can be preserved. There are now ways to conserve or to preserve the ova. If not that, there are certain injections and which can be given during the chemotherapy phase. And usually they have to start 1 week before the start of the chemotherapy, which can decrease the multiplication rate of the ova in the ovaries. And therefore, the chemotherapy will not hit them, because chemotherapy would hit which are multiplying. And since these are hormonal injections, we can stop the ovarian functions. And since they stop the ovarian functions and the cells become quiescent, they don't take up chemotherapy, and hence they do not get hit by the chemotherapy. So these are not foolproof methods, but they can give you almost 80% surety that yes, you are likely to conceive after your treatment is done. So yes, the simple answer is it does hamper your chances of conceiving, but there are certain remedial actions which can be taken to avoid that.
That was a very interesting answer. I think I've learned a bit here too. Of course, it was all learning, but on the last bit, definitely. Any other message that you have for us women on this International Women's Day?
I think there's an old saying, and which says that an ounce of prevention is better than a pound of cure. So you got to take care of yourself and do absolutely whatever is best for you. The various prevention strategies for breast cancer, at least, is having a good body mass index, doing regular exercising, eating healthy food. I'm not saying that you got to have a disciplined life 7 out of 7 days in a week, but you can have your own cheat days. As a matter of fact, it's good to get married in time and having childbirth on time. The risk of cancer increases if you have your first child after the age of 30 years. And in case you're still unlucky, it's always good to be aware of yourself. Self-awareness is the most important thing. And I think with that goes the saying that self-breast examination after the age of 25 years by every female, every month, immediately after the menstrual cycle is over, is a must for every female. Because if you detect it early, you treat it easy, and it is possible that you can get away with even chemotherapy. And with every centimeter increase in the size of breast cancer, your survival dips by 8%. That's a learning. So if you detect it early, you're likely to get away with the disease with lesser treatment and have your better chances of cure as well.
Thank you so much, Dr. Singhal, for sharing these pearls of wisdom and joining us on this session. Thank you.
My pleasure, always.